Hello, welcome to Triage Cancer's webinar, Making the Mouth-Body Connection During Cancer. My name is Sarah Tirani, and I am the Program Coordinator for Triage Cancer. I will be moderating today's webinar. Now, before we dive into today's topic, I just need to go over some housekeeping. All callers will be muted for the duration of the webinar. If you have any questions or technical problems, please type them in the chat box to the side of your screen. This webinar is being recorded and will be available for viewing by the end of the week on our website, triagecancer.org. After today's session, you will receive an email with a link to an evaluation. We would appreciate it if you would take a few moments to provide your feedback. As part of the accreditation process for healthcare professionals, we have to read the following disclaimers and disclosures to you. This presentation is intended to provide general information on the topics presented. It is provided with the understanding that the author is not engaged in rendering any legal, medical, or professional services. Although this content was reviewed by professionals, it should not be used as a substitute for professional services. The planners and presenters of this program have not disclosed any pertinent financial relationships or conflicts of interest. While this education program has received commercial support from the previously listed sponsors, the content of the program has no relation to the commercial interest of the organization's products or services. I am pleased to let you know that Triage Cancer is an accredited provider of continuing nursing education by the American Nurses Credentialing Centers Commission on Accreditation. Therefore, nurses participating in this live webinar and meeting the following requirements may be eligible for 1 contact hour of credit. In order to receive contact hours, you must have registered online for today's session. People who are listening in on someone else's computer are not eligible for credit. You also must attend the entire webinar. No partial credit will be awarded. Anyone watching a recording of this webinar will also not be eligible for credit. Within 1 week of this webinar, complete an evaluation and post-test. You must receive a passing grade on the post-test to be eligible for contact hours. You will receive an email following this webinar which will contain the link to the evaluation and post-test. Please note that on the evaluation, it asks for your name and email address, and you must include these so that we can certify that you completed the evaluation. That email is the address where we will use to mail your certificates. We will be sending out certificates within 4 to 6 weeks. For other types of healthcare professionals, we are more than happy to provide a general certificate of attendance. Just make sure you indicate that request on your evaluation. If you have any questions or experience any problems, email us at info@triagecancer.org. In order to receive contact hours for today, we have to be able to verify your participation. Therefore, if you are calling in from a phone, you must also log in from a computer or use the smartphone GoToWebinar app, and you have to input the audio pin. You can find the audio pin in the control panel to the side of the screen under the audio tab. And if you are already on the phone, simply press pound, the number you see on your panel, and then pound again. Now, for those of you who aren't aware, Triage Cancer is a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. We provide this in a few different ways. First, we host a Speakers Bureau of experts in all types of cancer survivorship issues available to organizations putting on an educational event. You can read our speakers' bios and request a speaker on our website. We also participate in events all over the country. Some of these events are hosted by our partners in the cancer community, and some are events we host ourselves. You can see where we are going to be if you look on our events calendar on our website. Every year, we host 3 Triage Cancer conferences. This is a day-long event that covers a variety of cancer survivorship topics. We welcome patients, survivors, caregivers, advocates, and healthcare professionals to this free event. This year, we will be in Chicago, Chapel Hill, North Carolina, and Houston, Texas. Registration and applications for travel grants are now open. And as you know, we host a monthly webinar series open to anyone in the cancer community. The next one will be on March 20th, Getting to the Sleep You Need. And recording of past webinars are also available on our website. In addition to our events, we offer a number of educational materials and resources online. Our quick guides are designed to be a snapshot of a particular topic. They cover areas such as health insurance, employment, clinical trials, financial topics, estate planning, and legal assistance. We also have checklists and other documents designed to help with the legal and practical pieces of cancer survivorship. All of these documents can be downloaded for free on our website, or you may order hard copies of these materials on our website at triagecancer.org/material request. And because we recognize everyone learns in different ways, we also provide educational animated videos on cancer survivorship topics. We just released this one on dealing with the side effects at work, with key information that you need to know about reasonable accommodations to help you work through treatment or to get back to work. We also have videos on health insurance basics and picking a health insurance plan. More are coming soon. We are also very excited to announce that thanks to the support of the California Dialogue on Cancer and Genentech, we now have several resources available in Spanish, including most of our quick guides and all of our animated videos. Recursos en español, pardon the accent. Again, these quick guides can be downloaded for free on our website. We also have compiled the contact information for some of the most frequently used state-specific agencies and resources on our site. And because where you live can impact what protections you have access to, we have charts of state laws on employment, disability, health insurance, and other cancer-related issues. Cancerfinances.org is a site that we host in the partnership with the SAM Fund that provides practical information on topics that can impact your finances. This website is designed to guide users to the information that is most relevant to their situation. We currently have modules on health insurance, disability insurance, education rights, and financial assistance resources. More topics will be added soon. And finally, our education blog not only provides great information about cancer survivorship topics, but because things are constantly changing in the cancer community, this is how we share late-breaking news. Our monthly e-newsletter is where we will announce all of our upcoming events. With no further ado, let me introduce today's speaker, Jill Meyer-Lippert. She is a registered dental hygienist and has been for 25 years and is the owner of Side Effect Support, LLC. The mission of Side Effect Support is to help improve the quality of life for those with cancer by focusing on managing and preventing oral side effects of treatment. Welcome, Jill.
Hi, thank you. Okay, well, thank you so much to everyone who's joining us today to learn more about the connections between oral health and cancer. I wanted to give you a little background. Am I able to advance the slides, Lara?
You should be able to. Try that.
Pushing my arrow, let's see. There we go. All right, so a little background. My personal interest in this subject of what is now known as dental oncology began many years ago, before it ever had a name, and I can trace it back specifically to June of 1992. I started my I was scheduled to begin classes for the dental hygiene program in a few weeks, and at the same time, my mom was diagnosed with breast cancer. Her diagnosis was followed by a mastectomy and 7 really grueling months of chemotherapy. And she suffered horribly with so many side effects, but especially so with side effects in her mouth. Her mouth was so dry that she would sometimes feel like she was choking from her tissue sticking together, but it was painful to even drink water to quench her thirst because of large mouth sores. And she was so miserable, and when she approached her oncology team to ask what she could do to help these side effects, she was told nothing. It was just part of treatments, and you just have to deal with it. And I found that very unacceptable. She was being treated at a large teaching hospital, and yet no one knew how to help her either on the oncology side or the dental side. So it became a personal mission to learn more. So someday maybe I could help someone in the same situation. But there were few options at the time to learn more besides from personal experience of patients at the office where I worked. So every person who indicated a cancer diagnosis on their medical history was an opportunity to learn more. I would ask them, what kind of cancer did you have? Did you have any side effects in your mouth? And if so, what did you find that helped you? And it didn't take long to see patterns. Many people indicated that they had side effects in their mouth to at least some extent. Very few reported that they were informed ahead of time of what to expect or given information on ways to prevent any of these issues. But what I found most surprising that many people came through their treatment successfully only to have a lot of damage to their oral health. And they just transferred all of this time and money and stress from an oncology setting directly into the dental office to try getting their mouth back into a healthy state. It became obvious that differences in education and a lack of communication between the medical and dental teams were resulting in patients getting incomplete and sometimes inaccurate information that was actually increasing their risks for oral side effects and damage to oral health. A perfect example, it's the one I go to all the time, is a longtime patient at the office where I currently work. And she was a 20+ year breast cancer survivor. And unfortunately, her breast cancer returned, and this time was found in her bones. The type of treatments she was receiving allowed her to continue on with her regular dental hygiene appointments. So when I saw her for her first appointment after her most recent diagnosis, I of course asked if she was experiencing any side effects in her mouth. And she said, "Oh yes, my mouth is so dry, but it's okay because my nurses told me to suck on lemon drops, and that really seems to be helping." I found it really shocking that a healthcare provider would recommend that an immunocompromised person with a dry mouth who is so susceptible to cavities, oral infection, to have frequent and prolonged exposure to an acidic sugary substance. And I love telling this story in presentations to dental professionals because there's normally a collective gasp heard across the room. But I soon discovered that this is a common recommendation, so much so that oncology departments were actually providing large bowls of lemon drops and Jolly Ranchers for their patients to suck on during chemotherapy infusions. So obviously there was a significant need that was not being met. And all of these experiences inspired me to help bridge the gap in care and communication. So periodontal disease, or was sometimes or commonly known as gum disease, and certain oral bacteria have been linked to several medical conditions, including heart attacks, strokes, diabetes, low birth weight in preterm babies. Most recently, many reports about Alzheimer's disease and also many respiratory diseases. And while direct cause and effect relationships have not been established, studies are continuing to confirm that there are many oral systemic links. And cancer is no exception. According to the National Cancer Institute, they published a study finding a 24% higher risk for those with severe periodontal disease for developing a primary cancer, and a 28% higher risk for those with no teeth compared with cases of no or mild gum disease. And a few types of cancers that are linked to periodontal disease and or specific oral bacteria are pancreatic cancers and esophageal cancers, lung cancers, colon cancers, oropharyngeal cancers, and also breast cancers. And there are more as well. And what is interesting is that current studies are sometimes finding specific oral bacteria embedded within certain types of tumors. And the belief is that those bacteria are somehow playing a role in the development of cancers. But there's many studies that are needed yet to really figure out how they are connected. There are also studies that indicate a link between oral hygiene and cancer survival. In Sweden, there were 1,390 randomly selected adults followed from 1985 to 2009, and data was collected in regards to the plaque levels in their teeth and cancer development and cancer survival. And they concluded that poor oral hygiene appeared to reduce positive outcomes with cancer treatments. So let's look at why oral health is important during cancer treatments. Obviously, we do not want our patients experiencing any more pain than they're already dealing with through their diagnosis or their treatments. Nutrition is vital to maintain weight and strength. Appearance and psychosocial issues. Our smiles have a huge psychological impact, and I think a great example is, again, another patient at the office where I work at now who's a breast cancer survivor. And when I saw her back after her treatments, she made the comment, I was so diligent with my oral hygiene. I kept telling myself, my hair will grow back, but my teeth won't. And I really think that speaks volumes about the quality of life issues. We don't want people to just survive their cancer. We want them to have quality of life during the process of treatments and into survivorship. And part of that quality of life also includes financial issues. A cancer diagnosis can be financially devastating to a family, so much so that there was a specific term created within the last few years called financial toxicity. So we don't want people to invest all of this money into the oncology setting and end up with a lot of damage where they need to spend thousands of dollars in the dental office to repair the damage onto their teeth after. For the delays in treatments, when you are diagnosed with cancer, you are given a very specific treatment plan, and that is because that is what's proven to work. It is the standard of care. And every time that you have to delay treatments or alter them in some way, you have lessened that person's ability to get the desired results. So we cannot have oral problems, oral infections, oral pain be a reason that they are having delays in their treatment. For effects on systemic health and other medical conditions, I think a really great example of that are your diabetic patients. As we talked about in an earlier slide, there is a connection between oral health and diabetes. And a diabetic person is just naturally more susceptible to oral disease and infection. And it has a very reciprocal effect for them because the more oral infection that they have, the harder it is to keep their blood sugar levels under control. So if you add a cancer diagnosis into the mix, you can imagine how much more susceptible they are to having problems in their mouth, which then can in turn affect their blood sugar levels, which can affect their ability to survive their treatments. As we all know as dental professionals, or any medical professional, that just because if you have an infection in your mouth, there's no reason it will stay contained in the mouth. It has every ability to spread to other parts of the body. And that's especially so for our patients with compromised immune systems. When going through treatments, white blood cells are affected. And as those blood cells are fewer in number, it's hard to fight off infection, and they become very susceptible to any type of infection in their body spreading that could become very serious or possibly spread into a sepsis situation, which could be fatal. So some larger hospitals have recognized the importance of oral health and have implemented oral care protocols that have achieved very impressive results. For example, at Johns Hopkins All Children's Hospital in Florida, patients and their families were instructed to brush twice a day and rinse 3 times each day. They also use cryotherapy, which is to suck on ice chips or popsicles or something very cold during and after chemotherapy. And the concept is that the cold restricts blood vessels in the mouth to reduce the amount of medication from reaching the oral tissue. And that helps to reduce getting mouth sores. So while it's difficult to get full compliance, especially with young people that just don't feel well, they did establish about a 60% compliance rate and achieved an impressive 50% reduction in infections of the oral mucosa. Sutter Medical Center in Sacramento has an award-winning program where all who are admitted for surgery will brush, rinse, and use oral moisturizers 4 times each day. It has reduced incidence of hospital-acquired pneumonia by 60% and saved over $2.4 million. And that's pretty impressive. So keep in mind that these results were achieved with the general population. So imagine what can be achieved in the immunocompromised population in oncology. So not everybody will experience side effects in their mouth during cancer treatments. And I just want to point out that one of the biggest misconceptions when I tell people that I have a business that is surrounded around the concept of helping to reduce oral side effects of cancer treatments, typically the assumption is that I'm only talking about oral cancers, and that could not be further from the truth. People with oral cancers are definitely at a heightened risk for issues, but they are not exclusive to having issues. So what it depends on is the type of cancer, the stage, the location, the type of treatments. Is it chemotherapy? What kind of drugs make up that cocktail of chemo? Is it radiation? What structures are affected by that field of radiation? And nowadays, we also need to be considering different types of targeted therapies that can have some pretty significant oral effects. The higher the dosage, the more chances they will have problems. The longer the duration of treatments, the higher the risk of problems. Choices and habits during treatments. Think of your smokers, your heavy soda drinkers, your people that don't necessarily do a very good job at keeping their teeth clean. Those things won't necessarily change after a cancer diagnosis. So that is where they really depend on their healthcare providers for education to help them understand how that is affecting their mouth and increasing their risks of problems. People that go into treatments with a very healthy mouth are much less likely to experience problems, but they are in no way immune to it. And the current state of systemic health, again, looking at your diabetic patients or other patients in general that are going into a cancer diagnosis with other medical issues, they may already be taking medications or have problems from their other issues that are affecting their mouth. So it just makes them more susceptible to more issues and them being more severe. And also with product selection. Product selection is a very important area that we'll spend quite a bit of time on during this presentation, because I think that is something that is overlooked quite a bit and has many surprising aspects to it. So there are several possible side effects in the mouth from cancer treatments, and these are just some of them. I mean, I could probably use a few more slides to even feel like I was being thorough, but for the sake of time, we are going to really focus mainly on the top 2 that are listed. One thing I want to point out is when we talk about on the first line where it has hyposalivation, xerostomia, dry mouth. Hyposalivation and dry mouth is actually the measurable salivary flow, where xerostomia is more of a perception of dryness. So many times these terms are used interchangeably, but there is actually a difference in their definition. And the thing to keep in mind with dry mouth is that saliva is amazing. It is one of those things that you don't know what you've got until it's gone. It has so many protective elements in there. Healthy saliva has calcium, it has phosphate, it has bicarbonate, and a dry mouth is acidic. So it needs those elements in order to stabilize the pH in the mouth. And those elements are also needed to remineralize tooth structure. They help to lubricate the tissue to prevent trauma. They play a role in wound healing There's antibacterial, antifungal, antiviral aspects. There are taste buds on our tongue that are dependent on saliva to function properly. So people with a dry mouth often will have more problems with taste changes, and you do hear that quite a bit, especially with chemotherapy, that nothing seems to really taste right. We need our saliva to swallow. It actually starts the very beginning stages of the digestive process. We need it to speak properly, and we also need it for restful sleep. Many people with dry mouth will report that they cannot sleep well because of the tissue sticking together. They may wake up feeling like they're choking. So that means getting up several times in the night to drink water and then use the restroom. And restful sleep is very important to help their bodies heal. So just to backtrack a second, knowing all of that about saliva and how important it is, look at this list and how many things that simply by effectively treating the dry mouth and not just masking it, all of the other things that we're helping to reduce or possibly prevent. We're going to help to reduce the oral mucositis. We're going to reduce risks of tooth decay and periodontal disease, enamel erosions, infections, taste changes, trouble swallowing. So treating the dry mouth, unfortunately, is sometimes seen more as a comfort issue when it is so much more than that. So some simple things that we can do for dry mouth is to use products, to stay hydrated is the first thing. I mean, frequent sips of water, carrying water with you, keeping water bedside. Dry mouth often also means dry lips. And if lips are cracking from being dry, that for somebody through cancer treatments can also be an infection source. When choosing lip products, it is best to avoid products that have petroleum in them. Petroleum puts a coating over the lips that prevents your lips from being able to absorb any moisture from the environment. It can trap moisture or bacteria underneath that layer also. So if you are dealing with cracks in the lips, it may help to promote bacterial buildup and infection. Better off with coconut oil, even virgin, like olive oil, things like that can be very soothing. If we can modify additional medications that cause dry mouth for other medical conditions, that can help to reduce some of the issues. There are also some prescription saliva stimulants and artificial saliva. There are a couple on the market that are older ones that also have a lot of side effects, and they have a lot of contraindications. So if we can avoid other prescription products that add additional side effects, that is the ideal thing. And so we're going to talk a little bit more about an option for a prescription artificial saliva a little later in the presentation that does not have the side effects that some of the older types did. And then looking at the over-the-counter products, there are several over-the-counter products that help to relieve dry mouth, but some of them are just meant to mask the symptoms. If we can look for over-the-counter products that contain the sweeteners xylitol and or erythritol, what those are natural sugar substitutes that have different carbon structures than sugar. So the bacteria that cause decay cannot metabolize them, and with regular use, it will help to cut down in the harmful types of bacteria in our mouth that causes decay. The sweet flavor of these sweeteners also tricks the nervous system into wanting to produce more saliva. So with oral mucositis, that is the inflammation and ulceration of the oral tissue. It's considered a major toxicity of cancer treatments. It's actually one of the main reasons that people have to delay or alter their treatments. It affects about 40% of those receiving standard dose chemotherapy and about 75 to 80% with stem cell transplants and nearly 100% of those receiving radiation to the head and neck region. There are certain risk factors that makes people more susceptible to developing oral mucositis. Some risk factors cannot be changed. including the extremes of age. So the very young and the very old are more likely to develop this issue. Females are more susceptible than males. Extremes of body weight, so they're very thin or the very large, are more susceptible. And there are also some races that are more susceptible than others. So what we want to focus on are the changeable risk factors, including treating the dry mouth, resolving any existing dental issues, and that could be anything that could be an irritation to the tissue. So it could be something as simple as an area that maybe catches food a little bit easier, or a rough edge of a filling, ill-fitting partials or dentures, or if somebody even has any orthodontic appliances, even some of those bonded retainers, that can just be an irritation to the tissue and encourage ulcerations. And of course, improving oral hygiene, because the more that we can reduce the bacterial burden inside of the mouth, it is much kinder to the tissue. So let's review some really simple things we can do to manage and prevent some of these complications. Keep in mind, our main goal is to be preventive, and I can't stress this enough, to deal with problems before they start and not just put out fires as they occur. Which means getting the patients to a dentist as soon as possible after diagnosis before treatments begin, when possible. Sometimes that is just not how it works, depending on the type of cancer that they are diagnosed with, especially like certain types of blood cancers. But in most cases, there is some time between diagnosis and the start of treatments. And if a dental visit can be part of that plan, it will help make the rest of the process go much easier. And again, that gives us the opportunity to remove those potential sources of infection and future trauma, and go over proper oral hygiene instructions to help them maintain that quality of life throughout the process. So let's look at what is plaque. If you look at the middle photo, you can see that yellowish film on some of the teeth, which is highlighted on the right photo with a disclosing solution. And if you would place some of that plaque under a microscope, you would see a large collection of live moving bacteria. Dental plaque is considered an organized biofilm, which means that different species of bacteria in the mouth colonize together, and it can actually communicate through cell-to-cell signaling and work together as a community to become stronger. The bacteria in the plaque biofilm digests fermentable carbohydrates, releasing an acidic byproduct. And this acid is what slowly dissolves and penetrates through tooth structures, causing cavities. So when we're concentrating on plaque removal and keeping down that bacterial burden in the mouth, there's really simple things we want to look at with product selection, including choosing a toothbrush. Our main goal with oral hygiene during cancer care is gentle yet effective plaque removal. So a few basic things to consider when choosing a toothbrush is the size of the toothbrush. Toothbrushes come in different sizes, and the heads are typically considered full, compact, or subcompact. What I have in the photo here is on the right-hand side is a full-size head. The middle is a compact head, and the left-hand side is actually a youth brush. But you can see that using a smaller compact head allows you to more easily access all the surfaces of your teeth with less risk of tissue trauma. A toothbrush head that's too large will not easily reach between certain areas, especially the cheek sides of the upper back teeth. And it puts you more at risk for damaging the tissue in some way. Bristles, you want extra soft or ultra soft round nylon bristles. Medium or hard bristles can be too harsh for tender tissue and also help to contribute to tissue trauma. Now, when you use softer bristle brushes, those bristles will tend to wear out faster. So as soon as you notice that you start seeing some bending or fraying of the bristles, that is when you should throw out the brush and get a new one. And that may seem like you're doing it more too frequently when you're using a soft bristle brush, but that is not necessarily a bad thing because your brush bristles can be a source of contamination. They can build bacteria on those bristles. So the more frequently that you are switching that brush, it just helps to reduce that from being a bacterial source, especially with your immune system being compromised. You can also help reduce that by allowing the brush to dry in between uses. If bristles are constantly wet, it's more likely to build bacteria on the bristles. Some people decide they may even use two toothbrushes and they'll alternate, so one has a chance to totally dry out before switching over to the other one. Some people may choose to cover their toothbrush. If you really think of everything that's going on in your bathroom, there's a lot of potential sources for contamination, and especially airborne. When you flush the toilet, there are studies that show that there can be an aerosol spray up to 6 feet in diameter. And you think of in the shower and everything else, the other things that are floating around in your bathroom that could potentially land on your toothbrush to become an infection source. If you see on the left-hand side, I have a picture of a plastic travel cup. And for anybody that has used one of those caps for traveling, you've probably noticed when you take that off, there tends to be like a white little cloudy buildup that occurs inside of there. And what that is a bacterial biofilm. So when you encase your toothbrush in that plastic, it's hard for the bristles to dry out, and you're basically encasing it in a plastic cap full of bacteria. An alternative is a really neat little device. It's called, well, I'm not saying a name of any products, but it is a fabric breathable cover that helps the bristles dry out, and it helps to reduce contamination, not only from airborne bacteria or viruses or fungus, but also through contact. So if you think of how a lot of families store their toothbrushes in the bathroom, a lot of them are in a cup, all in the same cup together, or possibly laying in a drawer together. And the simple act of one family member's toothbrush touching the other is a way that bacteria and viruses can be transferred from one toothbrush to another. And for somebody whose immune system is very fragile, that is a way that they could catch an illness. Another thing to keep in mind is using your own tube of toothpaste. Many people, when they are putting the strip of toothpaste out onto their brush, at the very end, they will tip the end of the toothpaste tube, kind of rub it on the bristles to get the rest of that toothpaste off. And what they've just done at that point is contaminate the end of that toothpaste tube. So every time somebody's using that same tube of toothpaste, you could be getting any type of virus or bacteria that's been left behind. So for, again, somebody whose immune system is very fragile, using your own tube of toothpaste can be one extra way that you can protect yourself from germs. Oh, and I actually going to go back for 1 second, because I should say with that breathable cover also, you can keep that on for up to 7 days. And you just basically throw that out and put a new one on, and that helps to reduce contamination of the brush. So flossing, and flossing is something you would not think would be controversial at all, but unfortunately, sometimes with going through cancer treatments, it can be, because when blood counts are low, especially the platelets, if the platelets are very low, people are very susceptible to uncontrollable bleeding. If the white counts are low, they can be especially susceptible to developing infections. So if somebody is not using proper flossing technique, it can put them at risk for putting little cuts into the tissue or starting bleeding easier. So what MD Anderson Cancer Center recommends is that flossing always be done in respect to blood counts. And typically, on the picture here, you can see that the proper flossing technique involves, once you go in between the teeth, that you curve the floss real tightly around one tooth like a C shape. And you can go back and forth a bit, but ideally you want to take that floss in an up and down motion that you are mechanically rubbing that whole inside edge of the tooth. And then you flip it over to the other tooth and you do the same. And ideally you would be going into that space between the tooth and the gum tissue. But if blood counts are too low and gum tissues bleed easily, they may need to modify it a bit and just go in between the teeth, but not go up underneath the gum line, because that may initiate bleeding that would be hard to keep under control. For products, we want to look at detergents, because some of the detergents in products are irritants, they're skin irritants. And the detergents are added in because this is what gives the products that nice consistency. It gives it that thick, foamy texture that makes you really feel like you're cleaning things well. The most common one that you'll find, especially in toothpaste, and you'll also see this in a lot of hand soaps, laundry detergents, shampoos, is called sodium lauryl sulfate, or some form of that. And that can be very irritating for some people. There's another one on the market called cocamidopropylbutane that can also be considered a skin irritant. And there's been some studies in the past that have shown that the vast majority of reactions tends to be in the head and neck area. So using toothpaste that are free of detergents may be one extra way to help reduce irritation of the tissue for people who are susceptible to it. And I don't want to say that all products that contain things like this are bad. I use toothpaste that have sodium lauryl sulfate in it, or the cocamidopropylbutane. I don't have problems with that because I'm not susceptible to mouth sores. But for people who are, it's one extra precaution that they can take to help reduce their risks. For products also, we want to avoid sharp flavors. Really sharp tasting mint or cinnamon may not only be too harsh for the tissue and feel like it burns the tissue a bit, but for people who experience nausea, that sometimes can be a trigger for them as well. Tartar control, peroxides, and whitening ingredients can also be too harsh for the tissue. And there are also products that may be considered, or ingredients, I should say, that may be considered endocrine disruptors. So basically, your endocrine system consists of glands and organs that control various bodily functions by producing and secreting hormones. These can be parabens, phthalates, and one that is of special interest when it comes to toothpaste is triclosan. This is an ingredient that's been used in many antibacterial soaps and hand sanitizers that is now banned in those different types of products by the FDA, but it is still allowed in toothpaste because of the benefits to reduce gingivitis. The thing to keep in mind with that is there are certain cancers that are driven by hormones. Some breast cancers, so basically if you are given a breast cancer diagnosis, one of the first things they would do is check that tumor for hormone receptors and see how much of a part hormones are playing in driving that cancer. If they are found to be hormone receptor positive, one of the treatments is to suppress those hormones. And that's the same thing with prostate cancer. 100% of prostate cancers are hormone driven by testosterone and dihydrotestosterone. So to treat prostate cancer, part of that is to suppress hormones. So it may be advantageous to avoid products that could possibly affect hormone production. And again, I cannot say this is something that's well proven. It's a bit controversial. For especially those patients, it may be worth looking at other products just to be on the safe side. If you're using an over-the-counter rinse, avoid rinses with alcohol, phenol, or peroxide. You can dilute rinses as possible, and there are several different recipes for baking soda, and it's supposed to say saltwater rinses, and it's just dependent on the recommendation of the preference of the provider. So all of these are acceptable recipes that people can try and just see what they feel works best for them. There are also some newer products or ingredients coming out that are pretty neat and some things to keep an eye out for. There are some oral probiotics, and probiotics are basically supplementing live beneficial bacteria. So as we talked about bacteria in the mouth, I mean, we all have bacteria in our mouth. Our bodies are made up of bacteria, some that are harmful and some that promote health. So the goal to remain healthy is to have the number of healthy bacteria to outweigh the bacteria that cause damage. For some people, adding oral probiotic that puts some of those beneficial bacteria back into the mouth may be a way to help get that healthy balance. The thing is, there's some studies right now that are showing possibly some benefits with probiotics in helping to reduce the risk of the oral mucositis. They're promising, but they're not studied well enough yet to have it be a full recommendation. So as far as recommending oral probiotics to our patients, that is something that I think we maybe need to just keep an eye on for future recommendations, but something we should maybe hold off on until it is more well proven. There's also the option of prebiotics, which the difference is you're not introducing live bacteria into the person. You are just offering elements that help to feed the beneficial bacteria so they can gain strength for a more healthy balance. And one of those for oral bacteria is arginine. It's an amino acid, and the healthy bacteria in our mouth thrive on that, and they get stronger, and it helps them to kind of gain power over those harmful bacteria. There's also a very interesting ingredient that's in some products nowadays called chitosan, and it is made or derived from the exoskeleton of shellfish, and it has really interesting aspects of being antibacterial and antifungal, anti-inflammatory, and it helps to retain moisture in the tissue. There's also some newer products that are very exciting because they are combining the prebiotic, the arginine, along with the chitosan. One prescription rinse that is very commonly used in many oncology settings is something called magic mouthwash. It is a prescription rinse, and there are many versions of it. Most of them have three basic ingredients. It is a coating agent like a Maalox or milk of magnesia or Mylanta. It oftentimes has a diphenhydramine, which is like an antihistamine, anti-inflammatory for the tissue, and some type of a liquid anesthetic like a viscous lidocaine. And according to the person prescribing it, it's all their preference, but there may be other ingredients added like antifungal agents, antiviral agents. The thing to keep in mind is that some of the ingredients in certain mixtures of magic mouthwash contain sugar. So diphenhydramine actually contains sugar. The antifungals contain sugar. Many of these mixtures of magic mouthwash also have a lot of side effects. So they may have a burning sensation in the mouth or cause taste changes. Some of them cause constipation for some people or diarrhea. So it's unfortunate, but I've talked to some oncology departments where magic mouthwash is prescribed across the board for people almost prophylactically, whether they've had issues in their mouth yet or not. And if they've had these issues where they've got ingredients that have the sugar in them, we're already adding some of the burning, the taste changes. We're going to be increasing their chances for tooth decay. And there are some organizations now that are recognizing that even though this has been a standard mixture used for many years in many departments, that is maybe not the best choice. And the American Academy of Nursing has a statement called Choosing Wisely, where it says don't use medicated or mixed medicated mouthwash, commonly termed magic mouthwash, to prevent or manage cancer treatment-induced oral mucositis. Oh, and all of a sudden my slide does not want to advance. Oh, there we go. All right. So acidity, every time we eat or drink, our mouth goes through what is called an acid attack. And that's where the pH drops and our teeth start to demineralize. And that means that calcium and phosphate ions are dissolved from the tooth structure, leading to the development of cavities. And this photo shows the pH of various substances, with 7 being a neutral pH. Anything above 7 is considered alkaline, while anything below 7 is considered acidic. The lower the pH, the more acidic it is. Teeth are made of a few different layers, and you can see in this graphic here that the top outer layer of the crown of the tooth is called enamel, and enamel typically has a critical pH of about 5.5, meaning that once the mouth's pH reaches 5.5, enamel will start to break down. The layer underneath enamel is called dentin and is softer than enamel and has a critical pH of 6.5. And the outer layer of the root structure is called cementum and already starts to demineralize at around 6.7. So it doesn't take much of a drop in our oral pH to start breaking down the cementum. But as we discussed before, healthy saliva contains calcium and phosphate, which play a role in raising the pH and remineralizing teeth to make them hard again. And it prevents tooth decay. So knowing that a dry mouth is an acidic environment, people with dry mouth have a harder time raising the pH to support the remineralization process and are much more susceptible to damage to tooth structure. Oh, having a little trouble advancing it again.
I am also trying to advance, and I am having a problem too. So let's see. Well.
Oh, there we go. There we go. All right. In May of last year, there was a study that tested 11 over-the-counter dry mouth lozenges. And unfortunately, 9 out of the 11 were acidic with a pH under 7, and only 2 were at a safer pH of 8. So if we have a dry acidic mouth and we add regular use of products that are also acidic, the pH stays in those very dangerously low levels to prevent remineralization of the teeth. And that is why it's so important for healthcare professionals to be aware of the pH levels in oral care products when making recommendations to our patients, especially our dry mouth patients. And to me, this reminds me a lot of the lemon drop example that I gave at the beginning. Oh, there we go. So looking at what is critical pH, I gave those numbers earlier, and those were generalizations of numbers. But what they have found is that the critical pH of different structures of the teeth is not constant, but rather it's inversely proportionate to the concentrations of calcium and phosphate in the saliva and the plaque fluid. So again, that is just reinforcing that people that have dry mouth and are missing that natural calcium and phosphate from healthy saliva, they're going to have breakdown of the enamel at much higher levels of a pH versus somebody who has healthy saliva. It's going to take less of a drop in their pH to have damage to their tooth structure. So an option, well, I talked about a better option in the beginning for some of the saliva substitutes. We can look at the supersaturated calcium phosphate rinse. And those are prescription rinses that are for dry mouth and also for oral mucositis. So by replenishing the natural elements from healthy saliva that's missing in a dry mouth, you are helping to raise the level of pH to reduce the demineralization of the tooth structure. It also helps to play some of those natural roles in reducing inflammation and helping with tissue repair. So that is a really favorable environment to the mouth to help protect not only the teeth, but the tissue. And prescription fluoride is also something that is considered a real gold standard during cancer treatments. And there are different types of prescription fluoride. There are stannous fluoride, acidulated phosphate, and neutral sodium. When you have a choice between these, the stannous and the acidulated phosphate can be harsher to the tissue. So if you're looking for the most gentle option to the tissue, it will be going with the neutral sodium. You have the option of taking impressions of people's teeth and forming customized trays versus doing a brush on gel. Trays are wonderful. It'll give them the best concentration, but it would be with the realization that their use may be limited because that may be irritating to the tissue for them. So if they start out using trays, if they understand they may need to go to a brush on gel if the tissue becomes sore and go back to a tray later on if they're able to. And there's also the option of what they call a fluoride varnish, which is basically a little gel that gets painted on. In that bottom photo, it's a tiny little paintbrush. We paint that on, it hardens on the teeth, and we do that at their dental appointments, and it can really help to soak up into the enamel to give them a lot of protection against cavities. All right, so let's wrap it up here to really talk about what does that mean, that what can the dental team do for patients before cancer treatments begin. And one of the big things is by accommodating that patient by seeing him or her as soon as possible. As I mentioned, when people are given a treatment plan, it's laid out very specifically that we do not want to delay or alter that plan in any way. So we want to get them in as soon as possible in case they have work that needs to be done, that they are not delayed in starting their treatments. They should have a thorough examination, including any necessary radiographs, and of course, including an oral cancer screening to check for any abnormalities inside of the mouth or potential spreading of any issues in there. And then treating the dry mouth and the mouth sores before they start. Establishing a basic level of oral health, and that is going to be, any fillings that need to be done, removing any infection, cleaning the teeth to remove any debris that may be causing an irritation to the tissue. And there is a product called silver diamine fluoride that is not an ideal long-term solution, but if you have somebody that comes into the office that has a lot of work that needs to be done, a lot of cavities, and there's just not quite enough time to get that all completed before they need to start treatments, what the silver diamine fluoride can do, it is a substance that can arrest cavities. It can stop them where it's at and stabilize things so they can at least get through treatments and then come back and have the final restorations done after treatments have been completed. And then providing resources for your patients, giving them ideas of what side effects might occur, giving them preventive strategies, and talking about over-the-counter products, giving consistent information from staff members so they're not finding out one thing to use from one hygienist and a different recommendation from the dentist, to being consistent within the office and what you recommend. And then I can't encourage enough for medical and dental professionals who are listening to help keep the lines of communication open to help provide the most complete patient care. So I would invite you to utilize my website, sideeffectsupport.com, as a resource for information, not only for yourself, but for your patients, and also for products. So it helps to allow them to find what they are looking for when they are trying to avoid or find these different aspects of the products that we talked about. So I thank you so much for joining me, but I guess we'll open it up to some questions and answers.
Thank you, Jill. Now is the time that if you would like to ask any questions, you can go ahead and put those in your chat box and we'll get to them. We got a couple here. One, Jill, you mentioned that the supersaturated calcium phosphate rinse was a prescription only. Is this something you can get in a regular, Walmart or CVS?
It is a prescription rinse, and it can be written out by your physician or your dentist, but it is obtained through a specialty pharmacy. And in fact, on my website, on the home page, there is a section where a prescription can be printed out and it can be edited, and then it is faxed into a specialty pharmacy whose number is listed at the top of the form, but it is not carried at local pharmacies.
Okay, great. One more we've got time for. And somebody here is concerned about the xylitol not being safe for dogs.
Yeah, that is true. Xylitol, I compare it to, it's just like chocolate and grapes and raisins. They're fine for you and I, but dogs can get very sick by eating them. Because their digestive system is just not set up to be able to handle that. And the same is true for xylitol. So it's best to keep any products containing this type of sweetener away from your dogs.
Okay, great. I think we are running about 2 minutes over at this point, so let's do the last couple slides here. Just to reiterate, there are some conditions for contact hours. In order to receive contact hours, you must have registered online for today's session. People who listened in on someone else's computer are not going to be eligible for credit. You also must have attended the entire webinar. No partial credit will be awarded, and anyone watching a recording of this webinar in the future will not be eligible for credit. Within 1 week of this webinar, complete an evaluation and post-test. You must receive a passing grade on the post-test to be eligible for contact hours. You will receive an email right as soon as this wraps up, which will have a link to the evaluation and post-test. Please note that on the evaluation, it asks for your name and email address, and you must include this so that we can certify that you completed the evaluation. That email is the address where we will mail the certificates as well. We'll be sending out those certificates within 4 to 6 weeks. For other types of healthcare professionals, we are more than happy to provide a general certificate of attendance. Please just indicate that request on your evaluation. And if you have any questions or experience any problems with this, please email us at info@triagecancer.org. And thank you to everyone. That is it for today. We hope that you have found this presentation useful and will continue to stay connected to Triage Cancer. Goodbye.